What concerns me is how often pelvic floor weakness begins quietly and stays unnoticed for far too long. It usually does not begin with one dramatic moment. It starts with small changes that seem easy to explain away. A little leaking when laughing, a stronger urge to go, a strange heaviness in the lower body. For many people, that still does not feel serious enough to pay attention to. It feels minor, temporary, something that will probably settle down on its own. In my 30 years of practice, I've seen this pattern develop more times than I can count. If you find videos like this helpful, subscribe and leave a like. I share these warnings so you can recognize the signs early before they become harder to ignore. And if you're dealing with something similar or have a question, write it in the comments. What makes this easy to dismiss is how ordinary it can seem at first. A person may think they simply waited too long to use the bathroom. Or maybe they coughed too hard. Or maybe they drank too much coffee that day. Some blame stress. Some blame poor sleep. Some assume the body is just becoming less predictable with age. So they move on and tell themselves it is nothing important. But the pelvic floor plays a bigger role than most people realize. These muscles help support the bladder, bowel, and the lower part of the core. They also help the body manage pressure when you cough, bend, lift, stand up, or change position. When support in that area begins to weaken, the body often sends subtle signals first. Not loud ones, not dramatic ones. Just enough to be inconvenient, but not enough to force action right away. That is why so many people ignore the pattern in the beginning. They notice urgency once in a while. They feel a small loss of control when sneezing or lifting. Some notice a light pressure low in the pelvis that comes and goes. Others feel less steady in the lower core, but cannot explain why. A few begin to feel that something is slightly different during a normal walk, after standing for too long, or when getting out of bed in the morning. None of that sounds alarming on its own. And that is exactly why people wait. Patients like you come to me with this exact issue, and the words are often very similar. They say it only happens sometimes. They say it is manageable. They say they assumed it was just one of those things that comes with getting older. What concerns me is not only the symptom itself, it is the delay. Because once the body starts losing support in this area, the pattern rarely improves just because it is ignored. I can't tell you how many times I've seen someone brush this off for months because the problem felt too minor to matter. Then little by little, the signs become more frequent, not always severe, just more regular, more noticeable, more disruptive than before. The body begins to repeat the same message, but in a way that is still easy to minimize if no one is paying close attention. One patient I saw recently mentioned that she first noticed a small leak only once in a while when she laughed. That was it. No pain, no major warning, nothing dramatic, so she let it go. Weeks passed, then months, and by the time she finally came in, she was not talking about one small moment anymore. She was talking about a pattern she could no longer ignore. What stood out was not only the symptom, it was how long she had spent adjusting to it instead of questioning it. This is one of those problems that often hides behind embarrassment. People do not always want to mention it. They adapt silently. They minimize it. They wait to see if it passes. Some even start changing small daily habits without fully realizing it. But quiet symptoms can still be meaningful symptoms. And this is where many people take the wrong next step. They either do nothing at all, or they jump into exercises without really knowing which movements help, which ones strain the area, and which ones may actually make the problem harder to correct. That matters more than most people think, because the next part is not just about weakness. It is about how this begins to interfere with everyday life in ways people do not expect. One of the most overlooked parts of pelvic floor weakness is what it starts to change in daily life. Not all at once, usually in small, quiet ways. A person begins adjusting without even realizing how much control the problem is starting to take. Some start planning their day around bathroom access. They think ahead before leaving the house. They avoid long drives. They choose a seat closer to the restroom. They say no to walks, errands, or social visits that once felt simple. Not because they are lazy, not because they are losing interest, but because they no longer trust their body the same way. Others begin changing what they drink and when they drink it. They cut back too much in the evening. Sometimes they cut back too much during the day as well. I've watched people do this hoping it will reduce urgency, only to end up more uncomfortable, more irritated, and in some cases more prone to bladder irritation because the balance becomes worse, not better. Sleep can also start to change, not always because of pain. Sometimes because the bladder begins interrupting the night more often. And once sleep becomes lighter and more broken, the whole next day can feel harder. Energy drops. Patience gets shorter. The body feels less steady. What started as a pelvic floor issue begins to affect confidence, mood, and routine in ways that are easy to underestimate. Another pattern I've seen over the years is how people begin moving differently. They brace, they tighten, they rush. Some hold their stomach in all day. Some clench through the hips and thighs without noticing. Some stop bending naturally or avoid lifting even light things because they feel vulnerable. But when the body starts compensating this way, tension builds in the wrong places. The muscles are working, but not working well together. That is where the next problem often appears. People hear that pelvic floor exercises may help, so they start squeezing hard, and often, thinking more effort must mean more improvement. But in this area, force is not the same as control, and repetition is not the same as coordination. What I've seen in practice is that many people are not only dealing with weakness, they are dealing with poor timing, poor breathing, poor muscle coordination. The body may be tightening when it should be releasing, or bearing down when it should be supporting. So even when they believe they are helping themselves, they may be reinforcing the same pattern that keeps the problem going. And this is where many people make a serious mistake. They focus only on squeezing, but ignore posture, breathing, pressure control, and how the deep core works together with the pelvic floor. That usually leads to frustration. They say the exercises are not working. But often the issue is not that movement is useless. It is that the movement is incomplete. I've seen very capable people lose confidence here faster than they expected. Not because the body failed overnight, but because the problem started shaping behavior little by little. They stopped trusting certain movements. They became cautious in public. They started thinking ahead all the time. And once that happens, independence begins to feel smaller. The exercises that may help most are usually not the most aggressive ones. They are the ones done with good control. Gentle pelvic floor activation, proper breathing with movement, relaxation where there is too much tension, small core support exercises that teach the body how to manage pressure more safely. In other words, the goal is not to fight the body, it is to retrain it. I remember one patient who had spent months doing what she believed were pelvic floor exercises several times a day. But when we looked more closely, she was tightening the wrong pattern each time. Her shoulders lifted, her breath shortened, her abdomen pushed down instead of supporting upward. She was working hard, but not effectively. Once the pattern changed, the progress looked very different. This is why technique matters more than people expect. The body does not always improve from effort alone. It improves from the right effort, repeated the right way, with patience. And the final part of this matters even more. Because there comes a point when this is no longer just about exercise. It becomes about recognizing when the pattern suggests something more serious, when outside guidance matters, and when waiting longer is the wrong decision. There is one final pattern I want you to pay close attention to, because this is where pelvic floor problems stop being only an inconvenience and start becoming something that deserves a more careful look. That pattern is progression, not a bad day, not an occasional episode, not one isolated trigger, a steady change, more frequent urgency, more disruption, more hesitation before simple activities, more signs that the body is no longer managing pressure and support the way it used to. When that pattern keeps advancing, I would not treat it lightly, especially if it begins to come with a stronger sense of pelvic heaviness, a feeling of bulging or dropping, difficulty fully emptying the bladder, repeated nighttime disruption, or changes in bowel control. Those are not the kinds of signs I would leave to guesswork for too long. In many cases, the damage begins long before the pain does. That is one reason people wait. They assume that if it is not painful, it cannot be serious. But the pelvic floor does not always warn through pain first. Sometimes it warns through function, through pressure, through control, through repeated changes in routine that slowly become the new normal. I've watched this exact mistake lead to bigger problems more times than I'd like. Someone adapts, then adapts again, then adapts a little more. Months pass, confidence shrinks, sleep becomes less reliable, movement becomes more cautious, and by the time they finally seek help, the body has been compensating for so long that the pattern is more stubborn than it needed to be. You do not need to panic, but you do need to pay attention. If symptoms are becoming more regular, more limiting, or more uncomfortable, that matters. If exercises make things feel worse, that matters. If you notice pressure, bulging, repeated leakage, trouble emptying, or changes in bowel control, that matters. And if this is starting to affect how you sleep, move, travel, exercise, or leave the house, that matters too. This is where calm, practical guidance becomes important. Start with controlled movements, not force. Focus on breathing, posture, and coordination, not just squeezing. Give the body time to relearn support. Avoid turning every movement into tension. And if the pattern has been going on for a while, or seems to be progressing, get proper evaluation instead of relying only on trial and error. Many people do well with the right combination of pelvic floor therapy, better movement patterns, pressure control, and consistent practice. But that usually starts with recognizing the real problem clearly, not minimizing it, not hiding it, and not assuming it will correct itself simply because you want it to. What concerns me most is when people wait until the problem starts controlling their choices. That is usually the point where the body has been asking for attention for a long time. And the longer those signals are ignored, the harder the pattern can be to reverse. The body rarely starts with a crisis. More often, it starts with a whisper, a small change, a quiet loss of support, a symptom that seems manageable. The people who tend to do best are not the ones who panic early. They are the ones who notice the pattern early and respond before the body has to work even harder to compensate. If this video helped you, subscribe for more guidance like this. And if you've noticed any of these signs yourself, or if you still have questions, share it in the comments.